Welcome everybody to this webinar. I'd like to welcome you to the 2018 National Healthy Homes Month webinar series. National Healthy Homes Month offers an opportunity to learn more about housing and its impact on health and provide resources to encourage local activities as well as empower families to protect themselves from hazards in their home. This May and June's outreach activities aim to greatly boost awareness and understanding of what federal and local resources are available to make a difference in the lives of all residents, regardless of where they live. For more information about National Healthy Homes Month, including resources for your program, you can visit www.hud.gov/healthyhomes. Today's webinar is Improving Your Home Environment, presented by Jill Bednarik in the Colorado Department of Public Health and Environment, and Selena Lujan, Environmental Planner from Healthy Homes Program in the City of Fort Collins Environmental Services Department. We are pleased that you have joined us for this event. This webinar series is sponsored by the HUD Office of Lead Hazard Control and Healthy Homes, the USDA National Institute of Food and Agriculture, and the National Healthy Homes Partnership. This webinar will last approximately 45 minutes to an hour with 15 minutes at the end for questions. At the end of the webinar, you will be given information on links to additional resources for your program if needed. We will be recording this webinar and posting it for your viewing later if you prefer. Finally, we ask that you mute your microphone, which we have already done, during the presentation. You may unmute your microphone for questions at the end. If you have questions before then, please feel free to post them in the chat window. So welcome Jill and Selena. And Jill, why don't you go ahead and get started?
Great, thank you, Michael, and hello, everyone. My name is Jill Bednarik, and I'm with the Tobacco Control Program at the Colorado Department of Public Health and Environment. I have the great privilege of coordinating the Colorado Healthy Housing Coalition, and today I'm especially honored to introduce to you Selena Lujan, who is a member of the Healthy Housing Coalition, as she presents the Fort Collins Healthy Homes Program Home Assessment Tool. I'll just tell you a little bit about the coalition and about the City of Fort Collins Healthy Homes Program before turning it over to Selena. The coalition is a group of local level, state and federal partners that work together across our various disciplines to promote healthy housing principles, programs, and strategies. So whether we come at this work from a public health perspective, environmental health, housing, or other related fields, or whether our discipline is, or the topics we work on, asbestos, lead, radon, secondhand smoke, we come across these different disciplines, as I said, to really work together. We have the great honor of being able to talk a little bit more about our coalition in one of the webinars next week that Michael talked about. So that's all I'll share with right now about the Healthy Housing Coalition. Next slide, please.
Oops, hold on. There we go.
So as I mentioned, the City of Fort Collins Healthy Homes Program is part of the Colorado Healthy Housing Coalition. And we like to really promote this program because it's such a unique model and really an excellent example of a local level program. The City of Fort Collins has this unique environmental health project in Colorado. They have a line item, it's funded within their own city budget, and really looking at ways to address asthma and other health issues in the home. They have a great model that Selena will go into that really works on educating families in a way that is something that families can hear and can grasp, and provides easy to implement ways to improve the indoor environment. The do-it-yourself model is really just an exciting tool that Selena will talk about, and we're so proud of them and what they've put together. And it really works at helping to empower families to make their home a healthy home, and it's really literally in the palm of their hand, a mechanism that they can use to check the home and to make changes. So we are delighted to be able to let one of Colorado's best kept secrets, this Healthy Homes model, and let that out of the bag and to share it with all of you and encourage others to replicate this model. As we know, the simple fact is housing policy is health policy. So ways that we can work at addressing housing quality and the indoor environment can yield dramatic improvements in the health and safety of families, as well as the economic well-being of Colorado communities and other communities. So with that, I'd like to welcome Selena and take it away, Selena.
Thank you so much, Jill. I really appreciate that wonderful introduction. And hello, everyone. As Jill introduced the Healthy Housing Coalition, it's just a wonderful space to be in with a lot of public health professionals. So if you're in the Colorado, Denver area and interested to learn more and get more involved at a community level, I highly recommend joining that coalition. It's just such a room filled with wealth of knowledge and an area where it's just a great source of networking. As Michael and Jill mentioned, my name is Selena Lujan, and I am the program coordinator for the City of Fort Collins Healthy Homes program. For everyone on the call who is not familiar with the area, Fort Collins is what I consider a very fun and active town nestled against the foothills of the Rockies. Approximately 165,000 people live in Fort Collins, and the beautiful campus of Colorado State University is located here with about approximately 33,000 students. And just as one last fun fact, Disneyland's Main Street was modeled after our very own Old Town. So if you're ever in the area, it's something to look out for. All right, so now back to why we are all here. The City of Fort Collins Healthy Homes program began in 2011 as a creative intervention to provide residents of Fort Collins the tools and information needed to help create and maintain a safe and healthy home environment. Therefore, our mission is to create a healthier community by improving indoor air quality and promoting a safe home environment through volunteer-based education. In achieving the program's mission, we offer free indoor air quality assessments of homes, and we hope to provide low-cost or no-cost recommendations that residents can implement to improve their in-home health and safety. Everyone within the city limits of Fort Collins, including renters, are eligible for an assessment, but the program has a larger focus on people with asthma, especially children, the elderly, and underserved populations. There are a lot of different healthy homes programs throughout the nation, but the City of Fort Collins program is unique in that it's the only one of its kind and is supported by a municipal government. So there were a variety of reasons why the city chose to develop a Healthy Homes program. At a national level, we saw a need for this program because Americans spend up to 90% of their time indoors, and indoor air quality is up to 5 times worse than outdoor air quality. And since 1994, the City of Fort Collins has conducted air quality surveys approximately every 5 years, and each has revealed that 1 in 4 families has a family member with a respiratory ailment, including asthma, emphysema, heart disease, or another respiratory ailment. So overall, this survey demonstrated the need for a greater focus on respiratory health in Fort Collins. Another huge motivator for this program is that the whole state of Colorado is located in Zone 1 for radon. So this means that Colorado homes are statistically more likely to be in areas that test higher than the Environmental Protection Agency's, also known as the EPA's, recommended level of 4 picocuries per liter. So this was a major concern to us, and we realized that there was a larger need for education around radon, including more information about testing and mitigation. So of the homes tested in Fort Collins, more than 65% of homes have tested above the recommended levels for mitigating. Our program and the assessments that we do are structured after the National Center for Healthy Housing and the HUD's 7 key principles of a healthy home. So those key principles are listed here on the screen as keep it clean, keep it pest-free, keep it well ventilated, keep it dry, keep it well maintained, keep it safe, and keep it contaminant-free. We address each of these principles by asking questions as they relate to each area of the home. For example, with the principle of keep it pest-free, we will ask the resident if they've ever had a problem with mice. If the answer is yes, then we would check how their pet food is stored and any areas where mice might be entering in. This is a critical principle during the fall when mice make their way into our homes. Covering each area has proven to be beneficial in identifying common household problems that can be contributing to poor respiratory health. Not too long ago, we had a call from a mom, a mother of a young child who was very, very sick. She couldn't figure out what was going on, and her doctors weren't able to figure out what was happening. He had coughs, was just not feeling good, and constant sinus infections. So we went in to evaluate the home and do a general assessment. And through our education that we provided, we weren't able to pinpoint exactly what was going on, but because we had the conversation about keeping it contaminant free, she was able to figure out that the hair product they were putting in his hair was actually making him sick. So a lot of what we look at is not only what's occurring in the home, but also what we're bringing in that could be contributing to poor respiratory health. And for others, the assessments assure them that they are doing all that they can do to protect their in-home health and their family's health. As we work through each of the principles, we answer 4 key questions. What's the problem? What are the health implications? Where do you look for the problem? And how do you fix it? Since this is an education-based program, it is important to provide key details around the process and why we are making specific recommendations around fixing the problem that we have identified during the assessments. So the way that in-home assessments work is residents have to call in and request an assessment. Since we are a self-referred program, doctors or other organizations can't call or request an assessment for their clients. During each assessment, there are 2 parts, including a discussion with questions related to each of the 7 key principles, and then following is a non-invasive walkthrough of the home. Each assessment takes about an hour to an hour and a half, and it is our goal to leave behind 3 to 5 low-cost or no-cost recommendations. Although we are more than happy to record as many recommendations as a resident would like. During the assessment, we also set up a radon kit, and we leave behind a carbon monoxide detector and a smoke alarm. And this is partly due to our partnership with our local Poudre Fire Authority here. They provide us those smoke alarms and carbon monoxide detectors to provide to each home. And we've found this to be a great need in our community. We also leave behind a sample all-purpose cleaner, in addition to a wealth of resources offered through the city. So as I mentioned earlier, indoor air quality is up to 5 times worse than outdoor air quality. So we highly encourage that our community members take advantage of all of our natural areas and our biking trails. So there's a lot of great city programs that we are aiming to make available to residents as we speak to them in their homes. And then after each assessment, the staff will follow up to remind the residents to mail in their radon kit after 5 days, 3 to 5 days. And then we follow up at 1 month to see which of the recommendations were implemented. This is one of our major metrics that we collect to see what the compliance rate is to make sure that the program is working well for people, and if not, how we can improve. So the Healthy Homes program is also unique in that it is driven by community members who volunteer their time as master home educators. Volunteer master home educators undergo a comprehensive 20-hour training on the 7 principles of a healthy home. And then they disseminate this information to Fort Collins residents through the indoor air quality assessments that they conduct. Through their training, master home educators are then equipped to identify common problems throughout the home, the health implications, and how to fix them, answering those 4 key questions we reviewed in the earlier slide. Upon completion of the training, they are asked to complete 1 to 2 assessments a month, and to keep them engaged and up to date on indoor air quality topics, we host continuing education events every quarter. The master home educators donate their time, and they are so dedicated to improving community health. So it's really important that we show our appreciation through an annual appreciation event for them as well. So since 2012, we have started to notice the demand for assessments exceeded the resources available to fill the requests. We consistently have had a wait list of about 11 to 13 people each month. And since this program is only available to people who live within the city limits of Fort Collins, we wanted to create an online do-it-yourself assessment tool that would help. The online website is designed to expand the reach of the Healthy Homes program not only at a local level, but also at a regional and national level. It optimizes staff and volunteer time, especially in doing more targeted outreach to underserved populations. And it provides the tools necessary to empower people to improve their in-home health at their own convenience. Some people don't feel comfortable having a government entity or strangers in their home, so this tool helps provide resources for those who otherwise may have not wanted an in-home assessment. We live in an age of technology, so it was important that we envision a tool that is usable at all levels, including individual use or through other organizations working with clients in this area. In order to create a tool where people can conduct their own assessment, we requested funding in 2016 through our city's budgeting for outcomes process, and we were awarded the funding in 2017. In January of 2017, we hired 2 local businesses, A-Train Marketing Communications and Rocket Jones. A-Train designed the look and feel of the product, while Rocket Jones completed all of the software development. The website is served off the server at Rocket Jones, and they continue to help us manage the website. It's been a great partnership as they have helped us bring to life our vision. It's been really amazing working with them, especially at a local level. They're actually within a mile of our office, so we had a lot of walking meetings, a lot of time spent together just bringing to life this vision of ours, making sure that this product was usable for everyone and was inviting and just had this look and feel that made it feel like I can do this in my own home. So the online do-it-yourself assessment tool is comprehensive of our in-home assessment process. We were intentional about modeling it after our in-home program so that users would have a similar experience. It is of an intuitive design and customizable based on the number of rooms and bathrooms in your home. It is also accessible to any user worldwide, and all users have direct access to our indoor air quality resources located on the Healthy Homes website. Currently, data is only collected for Fort Collins users, and only Fort Collins users have the ability to contact a staff member directly. Anybody can email the program, but there's a special feature for Fort Collins residents that can get them in contact with us, especially if they're now interested in having an in-home assessment or are wanting more information on how they can access a radon kit or fire safety tools. So the following slide contains a short video overview of what to expect when completing the online assessment. So I'm just going to set this up very quickly with our audio just to make sure that it matches up as best as possible. So give me one quick second as this reloads here. All right, thank you for your patience. One more second.
Hello, and congratulations on taking the first step to improve the health and safety of your home. My name is Amy, and I'll quickly demonstrate how to complete your home assessment. Begin by setting up an account. Enter your information and check your email for a message from us with a link to confirm your account and return you to this site. Then answer a few questions about you and your home to customize the assessment, and name your bathrooms and bedrooms so each room in your home is included. Now you're ready to start the assessment in any room you'd like. In each room, begin by watching a brief video and reviewing a diagram of where to look for clues. Then answer questions that speak to the Keep It principles. Healthy homes are kept dry, clean, contaminant-free, pest-free, well-ventilated, well-maintained, and safe. More information about the concerns and principles addressed in the questions is available, including the causes of problems, their health implications, and recommendations for improvement. After answering the questions in each room, you will receive recommendations, prioritized under the headings of Act Now, Act Soon, and Be Aware. You may return to these recommendations by following the links to the rooms from the dashboard, which also provides a summary of the rooms you have and have not completed. You may assess a few rooms at a time. Your work will be saved when you log out, and you can return to the dashboard after logging in to continue. After you go through all your rooms, you will receive a final report with a prioritized list of recommendations for your home and a score. You may update the responses in your assessment after taking the recommended actions to improve your score. And if you are a Fort Collins resident, we will follow up with you, and you may contact us with any questions about your results and recommendations. A helpful summary of the Keep It principles reflected in this assessment and how to apply them throughout your home is available under Resources, where you'll also find information about asthma and the main pollutants and contaminants found in homes, as well as many additional resources from the Healthy Homes program. Use the menu bar in the upper right of all pages in this site to access these resources, the dashboard, our contact information, and to log in or out. On behalf of the City of Fort Collins, we hope the recommendations you receive from this customized assessment will help you make your home healthier and safe.
So I hope everybody was able to hear that okay. That video is definitely a better overview and look into exactly what to expect when you go through the online tool. We're very proud of the outcome, and it's been amazing so far to see how it's been used throughout the nation, which I will get into now. So the website has been live since October of 2017, and we've had approximately 115 users nationwide. When we collect user locations by zip code. So as you can see on this map here, there's been a large concentration of users in Colorado, which makes sense because that's where we're at right now. And then in Texas, and you can see usage both along the West Coast and East Coast, including parts of the Midwest. So we're starting to kind of just watch usage a little bit more closely, but we are able to see more specifically is who has completed and how far they've completed the assessment, and then who has, and then the recommendations for their assessment specifically. So our intention, similar to how we follow up with our in-home assessment, is to follow up with users in Fort Collins as well, in addition to finding ways to get them a free rate on kits. So once the project was completed back in October 2017, we developed 3 stages of implementation. We are now wrapping up stage 2, and we are in the process of starting stage 3. Before we went live, we had 15 people beta test the tool using different devices and search engines. This was really important because the way we developed this tool is we developed it mobile first. So we really wanted to make sure that this tool was usable on all mobile devices. Because we figured as people were walking through the home, it would be a lot easier if they were able to walk through with their phone in their hands versus a laptop. So following that beta test, we worked with our marketing team to promote the tool within the community, and then we defined the metrics a little bit more that we were interested in collecting. And then we also defined how users can interact with staff and our follow-up process with users. We're still testing that out a little bit in terms of staff capacity, but we're getting closer to defining both those metrics and the follow-up process. So we just entered back into a contract with both A-Train and Rocket Jones, and we are currently working with them to add 3 enhancement features. So those enhancement features include the ability to save and email the final report of those prioritized recommendations. So right now, as you go into the tool, you just see those recommendations at the final stage, but there's no way to save them, print them, or email them to yourself. So soon, hopefully within the next quarter, there will be the capability of downloading, saving, emailing those recommendations. And then the second enhancement is to send comments or feedback to staff in real time. So we're wanting to add a lightbox feature on each page where people can quickly send us a message indicating which area or which step they are in the process to let us know if something's not working or if they have a specific question related to one of the questions or area that they're in. And then the last enhancement is the ability for staff to send reminder emails to users to finish their assessment, and a reminder email to implement the recommendations they were given. So those are currently under development right now, and we're really excited to see how those features turn out. And then down the road, we are also interested in bilingual functionality of the tool, making sure that it's all inclusive, making sure people can take advantage of it who speak Spanish. So Spanish in Fort Collins is the second most spoken language. So part of our request for funding was also to translate our materials. So we're in the process of translating all of our materials, and we're interested in translating this tool as well. And so we're constantly trying to find ways to enhance the tool, making it more available throughout the community and throughout the nation. And so to find that tool, our website link is on the bottom of this slide at healthyhomes.fcgov.com. So I ask that you use it, utilize it in the work that you do with other people, Tell your friends, spread the news, and please help us make it available anywhere you can. We're just trying to get this out there as a new innovative tool to use in improving indoor air quality, because it is so important, especially as so many people have respiratory health problems and are trying to find ways to live the best and healthy life they can. So thank you so much for allowing me to share this tool with you today, and happy Healthy Homes Month.
Thank you, Selena, and thank you, Jill. So I'm going to go ahead and try to unmute everybody's microphone so that you can ask questions. You're also welcome to put some of the questions you have in either the questions or the chat window. Let's see. It looks like I can unmute everybody. Does anybody have any questions? I'm in the process of unmuting Mike, so if you don't want it to be unmuted, please feel free to mute it back up. Any questions? Well, it looks like we have no questions. Selena and Jill, I appreciate your time. This is a wonderful webinar that you gave, lots of good information. The first thing I'm going to do when I get off the webinar is I'm going to go to that website and look at that assessment. That looks really fantastic. So I want to remind everybody that we were recording this webinar. We usually do post the webinar recordings on our website, the National Healthy Homes Partnership, at healthyhomespartnership.net. We usually will, again, give notice to everybody who registered where to find that recording. So again, Selena and Jill, thank you very much for a wonderful presentation, and I hope everybody has a great day.